topic is about introduction to OET. First of all, good morning, good evening, good night, wherever you people are. Uh, so we'll officially start our session in a couple of minutes. Let's wait for few more people to join. There are 25 participants. Today's, it's this webinar is about the introduction to OET. A little bit of insight about the exam, what this exam is about, what are the different parts of the exam, and then I have incorporated a little bit of reading test. The reason for choosing the reading subset is because nowadays I have been hearing a lot that a lot of candidates are struggling with the reading subset. So I have incorporated a little reading practice, and then I'll encourage you guys, and I'll be with you there in the session. You attempt the questions, and then I'll help you how to attempt the question, how to read in between the lines, and how to see everything. I hope that's understandable. Okay, let's officially start our session. So my name is Dr. Kashifaz. Who am I? Okay, so I have graduated from AJK Medical College, and about me, I have given my OET test back in 2021. After that, I have registered myself with General Medical Council through PLAB pathway and with Irish Medical Council. Currently, I am serving as an emergency medical officer in a hospital, and I'm doing my clinical side. And apart from that, I am doing teaching as well, not officially teaching, but I'm always helping my colleagues, my juniors, with different kinds of things, with OET, with lab, and different things. And what are my teaching skills? I am proficient in delivering medical education with focus, imparting on, making things easier for you. Let's not use very fancy words. My teaching skills and my teaching manner is just to make things easy for you and cater for you the way in which you understand. I'm committed, and I'm committed to professional development as well, which means that I'm continuously updating my skills through researches, through attending conferences, through attending different kinds of seminars and whatever. Okay, this is a little bit introduction of mine. Okay, now let's start our session officially. There are 29 participants. Okay, just in between the session, if you guys have any questions, just type it in between, I can see. Okay. So what is exactly OET? What is the overview of OET? So basically OET stands for Occupational English Test. It is a standardized English proficiency exam, okay, designed specifically for healthcare professionals. So this is a English language exam, but what makes it different, other than TOEFL, other than IELTS, it is specifically designed for healthcare professionals, and it tests your English proficiency. Okay, it does not test your medical knowledge. It does not test your clinical skills. All it tests is your English language proficiency. How good are you with the English language? Okay. And as I mentioned, unlike other general English language tests, OET focuses on assessed language skills within the context of healthcare, ensuring that candidates are proficient in communicating effectively with patients, colleagues, and other healthcare professionals. Okay, this is very important that it tests your communication with patients, colleagues, and other healthcare professionals, whatever the kind of people you will interact during your medical career, they will test you on that. The OET evaluates candidates' ability in listening, reading, writing, and speaking, okay, tailored to the demands and nuances of healthcare sector. OET is administered regularly throughout the year, usually once or twice a month. It's usually twice a month, but sometimes if there are any bank holidays, or if there are other festivals, it may happen once a month. But usually the pattern is it happens twice a month. Okay, depending on the test center and demand. Test dates and locations are available on the official OET website, and the cost of OET varies depending on the country and administration location, but generally falls within the range of 300 to 400 US dollar. Additional fees may apply for late registration or rescheduling. Now, we say that OET is for healthcare professionals, but what kind of healthcare professionals can attempt OET? There are basically 12 professions: dentistry, dietetics, medicine, nursing, occupational therapy, optometry, and whatever. You will have this information on their website, okay? Now, what are the purpose and benefits of giving or taking OET exam? If you pass the exam, what will, how, what will it make you eligible for? So the first of all, the purpose, as I mentioned, it is very clear. The purpose is to assess the English language proficiency of healthcare professionals. Okay, ensure that healthcare professionals possess the necessary language skills to effectively communicate in healthcare settings, and it provides a standardized measure of English language competency tailored to the healthcare context. That's its purpose. Purpose basically, it will test your English language proficiency, and that's it within the context of healthcare settings, and it will just that's the whole purpose of taking this exam. Now, what are the benefits? If we talk about, okay, we have paid that amount, we have given our time, we have given our energy to this exam, what are the benefits of taking this exam? Okay, so first of all, it facilitates your international mobility for healthcare professionals, allowing them to work or study. Okay, this is very important. You can also study in English speaking countries. Okay, it supports your professional development and career advancement opportunities for healthcare professionals by meeting language proficiency requirements for registration, employment, and further education. Okay, it is recognized by sorry, let me just note. It is recognized by regulatory bodies and healthcare organizations in various English-speaking countries. Like what? Like Ireland, Singapore, New Zealand, Australia. So if you want to, first of all, there are many people I have seen when I was taking the exam, there were many seniors of mine who were taking the exam. And at that time, I didn't know that, for example, if you are a specialist in your own country and if you want to work, let's say in the United Kingdom, and you are eligible for registration, but even though if you got the job, even though you have to take the OET exam, you have to prove that you can communicate in the English language, you can communicate with the patients, you can communicate with the colleagues, and you can communicate with other people in the hospital setting. Okay, so this is one of the I would say this is one of the major benefit of taking OET exam, that it facilitates your international mobility and it opens the door. It is just one step. It is just one step. It opens the door of opportunities for you. Now, coming to the before the subset, let me just tell you quickly about the delivery modes. OET is taken on paper, OET can be taken on computer, and in some countries, I'm not sure about what countries, but you can take OET exam at home as well. The details of that is given on the official OET website, but generally speaking, most people take the exam on paper, but some people, yeah, they do take exam on computer as well. If you're taking the exam on paper, you have to book it advance. I guess 25 to 24 days in advance, and your result will be announced after 17 days. And if you're taking the exam on computer, you have to book 7 days in advance, and your result will be announced in just 10 days. Okay, now little bit about the structure of OET exam. The OET exam consists of four subsets: listening, reading, writing, and speaking. As with any language, these are the four major components: listening, reading, writing, and speaking. These are the major four components for every language. If you have to assess any person that if he or she is fluent or proficient in that language, how will you test? You will test these four subsets. The total duration of exam is approximately 3 hours and 30 minutes, and each subset is designed to assess specific language skills relevant to healthcare professionals, and candidates must achieve a minimum score in each component to pass that exam. Okay, I hope I'm clear. You guys can tell me if you guys have any problem. I'm not having any kind of feedback. Are you guys there? Are you guys attentive? Are you guys with me? Somebody can type. I don't know if the chat is eligible or not. Anyways, moving on, we have these subsets. Let's, okay, somebody has, okay, yes, thank you, Afifa. And thank you, Mariam. Okay, let's go on. Listening. Now, what about the listening? The listening is approximately, okay, chat, yes, sir, audible. What is the minimum score? I will tell you about the minimum score. Alag, I'm telling you about, there are, I have provided the details of every subset. Okay, so I will tell you the minimum score. Okay, so listening. Now, coming to the listening, why I have put listening in the first place? Because usually this is the first subset to be tested in the exam. Listening is usually the first subset that you will be tested in exam. Approximately it is 50 minutes, but if you'll go on the website, it will say 40 minutes. So 40 to 50 minutes is the approximate duration of the listening test. Now, there are three parts, number of parts. There are three parts in the listening subtest, and there are 42 questions in total across three parts. Okay, listening, you have 40 minutes, you have further three parts, and you have 42 questions in those three parts. Okay, now what is the format or what is the structure of this? So generally speaking, you will listen to a variety of recorded healthcare related interactions such as patient doctor consultation or discussion between the two doctors. Then you have to answer the multiple choice question based on the information you're hearing. So how does that work? You will be given headphones on the day of exam, you will be given a paper, and then you will continuously listening to the audio, and then you have to attempt, and it happens simultaneously. You will not have time, to listen and then process and then write. You will be listening and simultaneously you will have to answer, and for that you need practice. You need practice, 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 otherwise you will mess up. And if you miss one part, if you miss one question, then trust me, do not panic. You have other, if you miss one question, you have 41 questions left. Focus on those 41 questions. Do not panic about the one question that you have left, missed, or whatever. As human, we make mistakes. Okay. So there are part A, part B, part C. As I've said, there are three parts in total. Part A can be discussion about two recorded healthcare professional. Then part B can be a short workplace extract where I just mentioned that it can be between two doctors, two colleagues. And this part C, it is presentation or interview extracts. And you have to listen to two different extracts and answer six multiple choice questions. Okay. Now, as someone has asked in the chat, what is the minimum score to pass? The minimum score required to pass the listening subtest varies depending on the grade required by the institution or regulatory body. Okay, typically you need to achieve, I would say 30 out of 42 pass, but listening is one of, I would say listening is one of the easiest subset in the OET exam. So let's just be realistic. Not every person is same, not every person has good listening skills, and not everyone has the same capability to manage the time. So I would say you have to be realistic. Aim for 35 to 37 marks out of 42, because listening is very easy, it is very manageable, and you can score the highest in listening. Okay, so 29 to 32 is usually the grade B, which is required by most of the regulatory body in order if you have to pass. But I would say 35 to 37, you have to aim for that. Okay, I hope I'm clear with the listening one. If you guys have any question about the listening part, please tell me now, then I'll move on. If not, then I'll move on. If you have any questions, please type in now. Okay, no questions. Okay, let's move on then. The next is reading one. Now, sorry. The reading is, again, it is approximately of 60 minutes. Number of parts. There are usually three parts in the reading as well. And today we will have a reading practice as well. So I will give you an idea of how to manage time, how to read in between the lines, how to attempt, and whatever. We will have at the end of this presentation, I have kept an hour, or you can say I've kept 40 to 50 minutes for the reading test as well. So that's what, that is why I'm going quickly, so we can have a little bit of feedback as well for the reading practice as well. So reading, it is approximately 60 minutes, number of parts. There are three parts in the reading subtest as well. Okay. And again, there are typically 42 questions in total across three parts. And you have to, what is the format or what is the structure? So basically there are three parts, part A, part B, and part C. So part A is like you will given be a text. It will be a long test given of different topics, and you will have to read that. And then there are some matching questions. Then there are some fill in the blanks and whatever. Typically there are 20 questions in that part, part A. Okay. The third part is called part B. And what exactly is in the part B? Part B is short workplace extracts. Okay, you have to read. There are 6 extracts in journal. You have to read them, and it can be policy document, hospital guidelines, journal guidelines, manuals, whatever. And you have to read that. And other when you once you read that paragraph, there will be given multiple choice questions, and then you have to select the most appropriate one. And then comes the part C. Part C is where what I have heard, or part C is where most of the people struggle, because you will be given two long, long articles. You have to read through those articles, and then you have to answer the questions given at the end of each article. Okay, and that is the most time consuming part of the reading exam, or I would say generally the most time consuming part of OET exam is to attempt the part C of the reading test. Okay, at the end of this presentation, I will tell you how to manage your time and how to save your time when you are attempting the part C. Okay, now the total score again is 42, and then again the minimum score depends on the regulatory body, but generally saying it is all somewhere between 29 to 32. And again, the reading, you can score full marks, you can score highest, but it varies with individuals. Okay, so generally speaking, I would say the ideal should be 32 to 35. This is a very, very achievable score. This is a very achievable marking that you can attempt in the reading part. Okay, okay, let me just erase this. Okay, reading. We're done with reading. Any questions about the reading one? Let me just give some time to the reading, because, as I said, most of the people struggle with the reading. So if you have any questions regarding reading subset, please let me know. I am waiting for your questions. If you have any question, please let me know. Okay, no, then we'll move on. Move on to the writing. Oh, okay, there is one chat. What is it? Can you repeat what will be in the part A or part B of the reading? Okay, FIFA, the part A, in the part A, what happens in the part A? In part A, you will be given a long context, a long text. For example, there will be multi-paragraphs. There will be 4 paragraphs. In one, there can be some information and the reading, listening, how much for before attempting test. Before attempting test, I mean, it depends on the preparation. It depends how good are you with the English language. If you're scoring before attempting, if you're scoring like best source for study, okay, I'll tell you. Yes, iPhone, FM, whatever. In part A, they will take away the booklet after you are done with the part A in the reading, okay? And then you will be continue with the part B and part C, okay? And Nandita, it depends what you know, how much eligible you are. But I would say with the practice, a good score is before attempting the real exam. I think in practice, you should be scoring somewhere 37, 36 before attempting the real exam, okay? And what is the marks criteria for each part? There is no marking criteria for each part. It depends on the subset. Okay, there is no marking criteria for the reading sub part. Okay, and 36 good to go. Yeah, Fadwa part A reading tech. Tech, what is tech? I don't know what is tech. Fadwa, can you please be a little bit elaborative? Okay, how to take strong grip on reading part C, and there is someone, Nihal, is okay. I will tell you about the part C. Okay, at the end of this presentation, I have incorporated a little reading practice. Then I'll tell you how to attempt the part C. For me, the part C is basically the best, you know, the easiest one. And Ahmad Samir is asking best source for studying, please. There is no best source. Okay, honestly, it you I'm sure you all of you guys have some data, all you guys have some kinds of test past test. I'm sure, because you know, if you are attempting this meeting, I'm sure you guys will generally have an idea or generally have some kind of you know, test available, material available. There is no best part. The best thing is you have to practice. You have to practice a lot. You have to practice what? You have to practice managing the time, and you have to practice how to read in between the lines and how to listen. That's the best. There is no best source. And Fadwa, you asked me part A reading technique. Okay, I'll tell you that as well. Okay, that is why I've incorporated the test. Do we have to read from some OET books or internet material and official websites? The official website samples are enough. For F1 FM, the official, if you just taking the samples that are on the official website, those are enough. But what we will do different, we will provide you with the material, and other than that we will provide you with the feedback, because you can practice on your own, but once you do not have the enough feedback, once you do not have the proper guiding, you cannot ace the exam. Trust me on this one. And a lot of people I know just fail the exam because of poor guidance and because of poor teachers, because somebody, your colleague will tell you, you know what, you do not have to prepare for this exam, just take a week before, just take some books, take some materials and go through it and you're good to go. No, it is a very subjective thing. Some people may take a month, some people may take a week, some people may not even prepare for the exam and they'll sit the exam and they'll ace it. So it is very subjective thing to say. So practicing and feedback is what matters a lot. Are you able to share the power presentation group? Rat, I will have to ask this to, if I can share, then I'll share it with you. Okay, but I will have to ask the organizers about it. Okay, I think they will share this presentation with you. Honestly, it doesn't have much thing to do. Okay, moving on. I think we have given enough time to reading. Okay, moving on to the writing one. Okay, guys, do not panic about the reading one. We will have a reading practice. Okay, so, okay, writing one. What about writing? By self and with friends, and indeed a social course is practiced by self. You have to practice. You can practice by yourself or you can practice with your friends. It depends. If your friends are serious, if your friends are cooperative, then you can practice with them. But if you just sit with them and all you do is talking and just wasting time, then I would say practice on your own. Okay, but you have to be serious, because any exam of this level, any competitive exam, needs to taken seriously. If you're not serious about the exam, then even if you pass, then your mentality has to be very serious. So it depends. If you have serious friends, if you have serious colleagues, please practice with them. You will be encouraged. Okay, coming to the writing part. Sorry. So what about the writing part? Okay, again, coming to the writing part, what is the duration of the writing exam? It is approximately 45 minutes, and there is only one part in the writing subset. Okay, good news. Now, once you have attempted three passing and three parts of the reading, now you are coming to the writing part. Okay, let me tell you. Listening, after listening, you have attempted three parts of the listening, you have attempted three parts of the reading. Now, I would say the second last part of the exam is writing. You're already exhausted. Your brain is not functioning. Maybe some people will panic about, you know what, I have missed few questions in the listening. I may have done better in the reading. You guys will be panicking, and then comes the writing part, and then you will be panicking. What is it? Is it a referral? Is it a discharge letter? What is it? So that is why I'm continuously focusing and continuously emphasizing that you have to practice. If you do not practice before the exam, then you will panic in the exam, because it's a 3 hours long test and there will be no breaks in between the tests. You have to, once you are finished with one subset, you'll be given the another subset. Okay, so the writing is the third subset generally, and it is 45 minutes long. There is only one part. You are required to write a letter based on the case notes, okay, or other relevant information provided to you. This letter can be typically it is a refer or discharge letter, mostly written in a formal style and tailored to specific recipients such as colleague, patient, or healthcare provider. Sorry. So what exactly is 45 minutes? You will be given 5 minutes to read the task. Some people may take 6 minutes, 7 minutes, and generally you will have 40 minutes to write the case notes or write the letter. So what is the format? The letter must meet specific criteria, including addressing the recipient appropriately, organizing the information logically, and using correct grammar, punctuation, and vocabulary. Now, coming to the score, the total score of writing subset is out of 45, and uh, the minimum score to pass is 31 to 34. I would say 32 is enough. Again, writing is something where everybody struggle with some part, but writing generally is easy because you guys have been going through medical education for the past 5 years, 6 years. Some of you guys may be working in a hospital setting. So you guys generally have an idea how to write a discharge letter, how to write a referral letter, and whatever. But what is different in this one, because this is an exam. What you have to do, you will be given a case note, and the case note can be very long or it can be very minimum. Okay, generally speaking, it can be of 5 to 6 paragraphs. You have to read through it. For example, there will be one task given to you that, this is the case note of a specific patient. He has been admitted in the hospital for the past 5 days with the complaint of pneumonia. Now you have to refer it to the respiratory specialist, or whatever the doctor. Please provide, please write a referral letter. Now, there is mentioned, let me just mark this one. Excuse me, sorry. Okay, writing. Now, what is important? You have to include addressing the recipient. Okay, they will be given information about whom you are writing the letter, whom you are addressing to. You have to include that information appropriately. You have to organize the information logically. For example, if there is given the patient was admitted 5 days ago, and treatment started, and the patient condition deteriorated, and he was shifted to ICU, and then he was given antibiotics. So you have to read, you have to write it, you have to organize it. You have to organize it. The patient came to us 5 days ago, and this is the treatment that we have offered to it, and his condition deteriorated. 3 days back, we shifted him to the ICU. He has been given steroids. Now, and then you have to write the information how the patient is feeling presently. Okay, then you will say presently the patient is not responding to the treatment. This is one of the reasons that we are referring him to a respiratory specialist, and all that. And there are some questions. I think listening is the most challenging, isn't it? Nowadays, reading is difficult as well. Okay, guys, please stop chatting. Yes, reading is one of the most difficult one nowadays. I have been, having these complaints. But as I said, generally speaking, some people will find reading hard, some people will find listening hard. So it is a very subjective thing. Do not tell anybody that, what, reading is easy, focus on listening. No, every human is different, every person is different. If one finds listening difficult, okay, no problem, I'm here to help, we're here to help. And generally speaking, somebody shares with this, you do not discourage them that, wow, I have scored full marks in listening. No, every person is different. You have to encourage your colleagues and friends. Okay. uh, and yes, in the writing one, you have to use the correct grammar and punctuation and vocabulary. Again, it is an English language test. It is not the test of your knowledge. So if you are not using proper punctuation, proper grammar, and proper vocabulary, you will lose marks in writing. Okay, for example, if you are saying, let's say yes, you have to put a comma after yes. Okay, if you are stating multiple different kind of treatments, you have to put a comma. If there is a disease, you have to start that with a capital letter. If there is an abbreviation, you have to write that abbreviation in capital letter. So what you have to focus in writing is that you are using correct grammar, punctuation, and vocabulary. It doesn't matter if you have messed up, any medical knowledge or whatever. You will be assessed on your English skills, not your medical knowledge. Could you please explain more about writing criteria and some tricks? Asia, I can explain, but the thing is, today's session is about a general, overview of this. There are honestly no tricks. The trick is that you have to you have to write smartly. Okay, you do not have to. For example, as I mentioned, that maybe there is a referral letter of a patient who is, who is having problem with his respiration, and you are referring him to a respiratory specialist. So you do not have to mention that he is also suffering from headache, or he's also having some other kind of problems. You have to always mention the relevant information, and in an organized manner. For example, 5 days, 4 days back, you have to organize that. 5 days ago he presented, 4 days back we started this treatment, 3 days ago this, and presently he is feeling like this way. Okay, you do not have to. Yes, you can mention that he is also having some other problems, he is having multiple diseases, but you do not have to mention everything. He can be diabetic, but this is not relevant. Okay, you have to just write the relevant information, and that's it, you're good to go. And writing criteria, as I mentioned, the writing, you will be judged on your grammar, punctuation, and vocabulary. That's it. And yes, if you are putting irrelevant information, you will lose marks. And generally speaking, there is a thing that you have to write the letter between 180 and 200 words. Yes, that's true. Because if you write irrelevant information, your letter will be long. If you, generally speaking, anything more than 210 words, you should be worried, because as I said, it is a 45 minutes test. In 40 minutes, all you can do is you can write 180 to 200 letters. And the minimum score to pass is 31 to 34. Okay. Okay. Let's go to the last one, which is speaking. Okay. Now coming to the speaking, it is generally, okay, there is a message, how to improve reading. Okay, Dr. Asad, we can improve reading. I will tell you how to improve reading at the end of this presentation. So just stick with me. Okay. Okay, coming to the speaking approximately, how can I'm not relevant, because you usually have to mention all the comorbid. You have to, Afifa, you have to, the point is, I'm making a point here, okay, that you have to be relevant. What I mean is that diabetic can be relevant. You have to mention that it is a comorbidity, but you do not have to mention that, the side effects or other things that he is suffering from diabetes, because the main complaint of the patient is that he is admitted because of respiratory problem. For example, he's having pneumonia. Okay, yes, you can mention that he's comorbid, he's having diabetic mellitus, because and that will show that his immunity is weak, but you do not have to dive in more than that. You do not have to provide more information other than that. Other than that, if you're providing more information about the comorbidity, yes, you will lose marks. That's what I'm trying to say. I'm trying to make a point here. You have to keep the relevant information. That's what I'm saying. Okay, coming to the last one is speaking. Speaking generally is approximately 20 minutes, okay? And it is one of the easiest one, and it is the last one. Once you are done with listening, reading, and writing, you will have a break, and then, depends on the number, depend on the time. The candidates have different times. Their speaking will start when their speaking test will start. There are two parts in the speaking subtest. So, sorry, the part A and part B. In part A, the candidate participates in a role play scenario with a trained interlocutor simulating a typical healthcare related interaction. Okay, the scenario may involve taking a patient history, providing advice on treatment options, or discussing a healthcare issue. Candidates are given some preparation time before the role play begins. Okay, I don't know who is putting these marks on the screen. Please do not do that. And then part B, discussion role play. Candidates engage in a discussion with the interlocutor on a healthcare related topic. The topic may be related to the current healthcare issues or professional experiences or ethical considerations. Candidates are expected to express their opinions, provide examples, and respond to questions from the interlocutor. Format. The format is candidates are evaluated on their ability to communicate clearly, respond appropriately to questions and prompts, and demonstrate empathy and professionalism in their interaction. The total score again is 45. And as with the other subset, the minimum score required to pass the speaking varies depending on the grade required by the candidate's institution or regulatory body. Typically, you need 31 to 34 out of 45 to pass. Okay, so why I'm saying the speaking is one of the easiest one, because there is a trick. You have to break down the speaking one. You have to just you know there is a cheat code for everything. So you have to just, oh, what is this question? Course for medical or not? So OET can be given by any healthcare professional, Muhammad Abdullah. It is generally, the format is the same, the test is same, so it can, the course is for anyone who is related with medical profession, any healthcare professional. Okay, sir, can you explain part B again? Part B of what, Ghulam Ruqayya, of part B what? Listening, speaking, what? Which part B are you talking about? Please tell me that. Speaking. Okay, okay. So generally speaking, so you will be given, it is a 20 minutes test. Okay, you will enter in the room and there will be an interlocutor and you will be given a paper in front of you. and it will the both of these tests will like 5 minutes. Okay, you'll be given some time before that, a couple of minutes to read the scenario or whatever. Then there are actually questions given at the end of that. The cheat code is, the trick is, you have to stick to that questions. Okay, you have to make sure that you're asking those questions. There is a reason those questions are there on the paper at the bottom of that paper, because they're judging you on that. They will try to shift the conversation from other, from one question to another. For example, if there is a scenario and the question is, for example, in my case, when I took exam the speaking, there was the scenario of ingrown toenail. Okay, and you have to ask the question, you have to ask the examiner what happened, and he will shift the conversation directly to the treatment part. And in between there are two questions: how did it happen? Is this the first time this is happening? Is there any pain? So once he's trying to, shift you, and he's trying to make you skip two questions, you do not have to do that. What you have to do, see, there is, you have to answer his question in a professional manner and demonstrate empathy. You have to tell that, okay, I'll answer your question, but before that, let me ask you a few quick questions so I'm in a better position to answer your questions. I have to make sure that you do not have any pain. I have to make sure you do not have any other kind of uh, problem with that, because if I offer you painkillers, some painkillers can interact with each other. So you have to improvise. Yes, you have to improvise, and you have to be very clear. You do not frown, do not get angry, do not get frustrated if the patient is not listening to you, if the patient is not responding to you. Generally, the patient will respond, but some examiner may be good, they will interact with you, they will give you some cues. But generally speaking, examiners, what you will ask them, they will answer you that question. So you will have a set of questions you have to ask them. This is part A. And part B is generally the same. For example, in part B, what happens is you may be given one issue. For example, let's say COVID. You will be given, card of COVID, and generally speaking, in that there will be saying, let's say, some policies that you have to maintain social distance, you have to wash your hands. Then you have to discuss that. The examiner now can be your colleague, and you are asking again. There are some questions given at the end of that paragraph, at the end of that text, and you have to ask those questions. There is one question: what is the difference between consultation role play and discussion role play? That is what I'm saying. Consultation role play, you are the doctor, you are the lead, you are telling him or her the kind of treatment options, the kind of diseases, the information, whatever. This is the consultation role play. And discussion role play is that examiner cannot be a patient, it can be your colleague, it can be your senior, it can be your junior, and you are just engaging in discussion with a health related topic. Example, I said, for example, COVID, you can be, the examiner can be your colleague, and you are generally speaking about the kind of changes you are implementing in the ward. So you can say, we have to maintain social distancing. Again, the key to is the speaking exam is stick to those questions given at the end of each text. You have to stick to those questions. That's it. You won't have much time. You will have only 5 minutes, and in those 5 minutes, you have to make sure that you are asking those questions in a very professional way, and you do not have to rush. That's the key. And again, sorry, practice. Practice is the key to the success. Once you practice these kinds of things, once you practice with your friends or whatever in 5 minutes, then in the exam you will not panic. Otherwise, you will panic. I'm again emphasizing on the practice one. Okay, before going ahead, anybody has any question, please ask now. Then we will go ahead and we will start some practice test as well. But before that, ask if you guys have any questions, please ask. Okay, there is one question. Do we have to simply the medical terms to the patient? Yes, yes, Malika. Yes, that's the key. You have to do that, because again, as I'm saying, that this generally there are not many. You will not be given that situation where you have to simplify. But yes, for example, if in the speaking part, if you are given a task that you have to explain the patient about what, let's say. Okay, let's say if he or she has been in some kind of accident, and You have to tell them in a very simple way that you have to take these tablets, these are painkiller, it will help you with the pain, and you have to not, if there is written that tell the patient you do not have to mobilize, maybe the patient do not know what is mobilize, you have to tell them you do not have to walk, you should rest. Okay, if you have some kind of activity to do, please make sure that you have people to help you around. Yes, you have to simplify, you have to use the simple words to make it more simple, and to make the patient understand what he or she is having. To book an OET test, should we create a GMC account? No, you have to create an OET account, Ali. You do not need a GMC account to book an OET test. Give us tricks to go through OET easily and control time. Okay, Nihal. Generally speaking, Nihal, honestly, there is no trick. There is no trick to go through out easily. Again, as I'm saying, practice. For example, if you have taken, if you are took the practice test, you have practiced on yourself, let's say 5 times before attempting the test, then on the sixth time it will be easier for you. You have, you are taking this exam sixth time. Doesn't matter if it's a real exam or if it's a mock exam, but once, even on your own, if at home, if you have practiced 5 times before the test, then the sixth time will be easier for you. Again, if you're taking that, if you have not practiced, if you have practiced once or twice, then at third time you will not be that confident. So the key to is the exam is practice. Can you briefly repeat listening part again? So in speaking, we should not use that much of medical and English vocabulary, or should we? In speaking, Afifa, I will get back to you, iPhone. In generally, in speaking, you do not, as I said, the key is the speaking test is stick to those questions. And yes, you do not have to use fancy vocabulary, fancy medical knowledge. Keep it simple, okay? Keep it simple, and you will ace the exam. You do not have to worry about using fancy word or whatever. OET score is valid for how many years? It depends on your Ali. It depends on the again regulatory body. Generally speaking, OET is not expired, but some regulatory bodies they say if you have attempted the OET in the past 2 years, then we will take your score. Otherwise, if it's more than 2 years, then you have to retake the exam. What are the books for practice OET exam? Do you suggest OET to take on paper? Okay, Neha, there are not many books. You will find a lot of data online, a lot of books in the store to practice for OET exam. Generally speaking, whatever the material you have, just practice. Again, at ProMedic, we will provide you with the practice, scenarios. We'll make sure that you have practiced, and we will make sure that we are pointing out your weaknesses and your mistakes. That's it. You do not have to worry about what is the best book, what is the best source. Every source is good, every book is best. And in what was that? Yeah, can you briefly explain the listening part again? Okay, I'll come to you. Malika, what I suggest is, see, again, it's very subjective things. For example, if someone who has, taking exam throughout the medical school on paper, and he or she is used to read or write from book, he or she like the physical appearance or physical presence of book, then I will say go for the a paper one. Otherwise, if you're someone who is more comfortable digitally, someone who has good typing test or typing speed, or someone who has a lot of interaction with the computers, then go for the computer one. It's a very subjective thing, it depends on you, on your personal choice. Okay, this again, this candidate asked me, can you briefly repeat the listening part again? Again, the listening part has 3 parts. It's 40 to 50 minutes long, and again you will be given headphones, and you have to listen to those conversation, and you have to answer. There will be fill in the blanks, you have to answer those questions simultaneously. And then there is other part, you will listen to the conversation, and then there are multiple choice questions. Then you have to, once you have heard the conversation, there are multiple choices given, you have to choose the right one. What is the, will you please share recorded webinar of today? Yes, Sanya, sure, no problem, we can do that. Okay. Now I will stop taking the questions because I have incorporated a little reading for you guys. Question will be in front of me when listening. Yes, Alag, you will, the question paper will be in front of you. Okay, next, preparation guide. What are the some key points when you are preparing for the exam? Again, you have to understand the test format. As again, as I'm telling you, listening consists of three parts, reading consists of three parts, speaking consists of two parts. So once you are familiar with the test format, it is easier for you to attempt. Okay. In reading part A, do they take paper away once? Yes, yes, Asia, they do take the paper away. And then you have to assess your English language skills. Okay, let's be honest. You guys, everybody knows what are their strengths, what are their weaknesses. Again, as I said, some people may struggle with reading, some people may struggle with listening. So you have to assess your own self, your own weaknesses. If not, then attempt these exams. We are here to guide you and we are here to point out your weaknesses, and you have to work on that. Again, practice regularly with OET preparation materials. Again, few people have asked what is the best source for OET, what is the best source for OET preparation materials. As I've said, you will have lots of material online. You can have free materials on the OET website. Those are enough. The key to ace the exam is practice, nothing else. No source will make you pass the exam if you have not practiced. Okay, now focus on healthcare vocabulary. What does I mean by that? For example, if you are given a referral letter and you're saying that I am sending this patient to you because this patient has been admitted here and he is not improving, then you will lose the marks. Healthcare vocabulary, you're not sending out the patient, you're referring the patient. Okay, you're referring the patient. That is what healthcare vocabulary is. Referring, discharge. Okay, these are the kinds of things that you have to focus on. Again, improve listening skill through practice. Again, enhance reading comprehension by reading healthcare related texts. Develop writing skill by practicing. Again, practice speaking. Practice. Again, the key, the summary of this webinar is you have to practice and then seek feedback from teachers or peers. Feedback is very important because, for example, you may be practicing on your own and maybe you are stuck, let's say, on 32 marks, and you will not know what exactly is wrong with you, where you are lagging. So you have to seek feedback from teachers or peers or someone who has taken the exam, and he or she will tell you, where you are lagging, how to increase your score. And again, you have to manage your time effectively. There is a time limit on every subset, and you have to manage your time very effectively. And the last one is you have to stay calm and confident throughout your preparation and your exam. As I said, you may mess up with one part, and you have to, for example, listening and reading, and then comes the writing. You're already mentally exhausted, but stay calm and confident. You have been, giving exams all of your life. You are a doctor, you can do this as well. It's not something you cannot do. Just stay calm and confident and believe in yourself. Thank you, Dr. Asad Imtiaz. In part A of reading, do we have to answer while looking at the text booklet, or they will only guess? No, you can answer while looking at the text. Okay, you will have both of the things. Okay, what's next? What are the common mistakes to avoid? Let me see at the time. Okay. Okay, the common mistakes that you guys need to avoid is lack of preparation, okay, neglecting any section of the test, poor time management, not seeking feedback, procrastination, and lack of consistency, not simulating test conditions, understanding the importance of English language skills, and ignoring official study materials. And again, what you have to again avoid is people who will discourage you, or people who will diss you, or some people who will misguide you. As I said earlier, there will be some people who will say, listening is the easiest part, so you do not have to take so many exams, or you do not have to practice very long for listening. Again, you have to ignore these kinds of people. Once you are confident in your own ability, in your own preparation, then you're good to go. Do not listen to these kinds of people. Okay, what now? Okay, so there is a practice test of reading. Okay, I will give you guys 5 to 10 minutes. If you guys want to take break, we can take break. Or if you guys want to ask me question. And after, let's say, 5 is 48. After 10 minutes, I'll start the reading practice test. So if you want to take break, if you want to sip on some water, go on, or if you want to ask some questions, I'm here. Tell me few tips about reading. Okay, Nihal, just click through this session right now. After 10 minutes, I will start the reading exam. I will start the reading practice. Then I'll give you a few tips. Okay. Meanwhile, simultaneously, I will provide you some tips that how to attempt the reading test. Do you have any specific question? Are you struggling with any specific part of reading? Can you tell me about that? How to avoid mixing with answers in MCQ? How to avoid mixing with answers in the MCQ? What part are you referring to, Nihal? Can you please be a little bit clear on this one? What part are you referring to? Part A, part B, part C? Which one? Reading part B. Okay. Yeah, part A, reading timeouts, ASEAN. Okay, Nihal, I will in the exam stick. Nihal, for you, I will tell you, please stick with me. Once I'll start the exam, when I'll start the practice session, you will have the reading part B. Let's say I will see how you're attempting, and I'll tell you how to attempt the part B and what are the some tips and tricks for that. And Asia part A, reading timeouts. Timeout? What do you mean? Part A, reading timeouts. Surrounding buffers of extreme concise prejudice. I mean, how many hours a day should one allocate to? Walaikum assalam, Casey. Thank you for your feedback. And how many hours a day should one allocate to revision? And should one attempt revision by tackling all subsets every day? Casey, see, again, you guys may fed up this response of mine, but it is a very subjective thing. Okay. uh, it is, for example, if you are, I would say, okay, generally speaking, okay, let's not dive into that. I would say 2 hours to 3 hours is uh, enough, depending how many time do you have. For example, if you have booked the test 24 days in advance on paper, a couple of hours, 2 3 hours a day is enough for you guys to prepare to study. And okay, I should run out of time. Okay, that's what I'm saying. Practice is necessary, and that's why you have to practice a lot. And you have to okay, how do you manage time? You have to read fast, and while, as I'm saying, you have to read fast, you have to make sure you are not missing out the relevant information from that. Okay, how many students do we have? 44. Okay, I think it's enough. Do you guys have any other question? If not, then I'll start the practice session. Okay. uh FIFA, we are planning to arrange a webinar on the PLAB exam as well. We are actually, under some preparation, and then we will arrange a webinar like this on PLAB too as well, on PLAB as well. We are actually, under some, you can say, construction or whatever, but yes, this is in our mind, this is in our plannings. We will inshallah soon arrange a webinar like this on Plap2. Please do tell me, guys, if you are having benefits from this webinar or not. Please do give me feedback as well. As I mentioned, feedback is very important. Okay, okay, I think it's enough. You guys do not have any other questions. Okay, I'll start the practice session one. Please, you guys stay along with me. And okay, guys, can you see the exam? This webinar turned out really helpful for me as it has your knowledge. Okay, FIFA, I'm happy. Thank you, Neha. Okay, guys, these are the these are the practice tests. Let me just zoom it out for you. One page. Wait. And here, yeah. Okay, so uh, so this one on the left side of yours is the text, and this one is the text, and this one on the right side are the questions. So uh, as I said, the reading part is 40 minutes. Okay, so what I will try to do is I will try to make sure that you guys have the taste of the exam. So see, this is the textbook part A. Okay, and generally speaking, how much time do you have? You have 15 minutes. Okay, and this is the question one. So, okay, so what I will do is okay, so the 15 minutes will start from now. What is the key? You have to read the text on the left, and simultaneously you have to read the questions on the right as well, and try to answer that. I'm sure the questions on 1 to 7, these are not in an organized manner. It can be from any of these texts. Okay, so I'm sure a lot of people of you, I will try to scroll it down. So that's what it is, a practice test. So it's a 15 minutes. Let's just give 5 minutes to read the whole of this. Okay, I'm here with you guys. I will not read along with you. I'll, turn off my camera. You guys read. I'll give you 5 minutes, and I'll scroll it down after a few seconds. Okay, so your time starts now. Start reading it. I will only give 5 minutes for this one. Okay, I'm scrolling down. Okay. Okay, coming to the last text. Okay, time up. Please tell me, have you guys gone through this one on the left one that I'm scrolling through? Everybody wake up. Have you guys gone through this one? Yes, okay. Okay, so see, this is a 15 minutes test. In 5 minutes, you have gone through this text. It's not that hard, okay? All it takes is 5 minutes, or sometimes let's say 6 minutes. Then you are left with 10 minutes, or you're left with 9 minutes. You have to give that to this one, these questions. These are generally 20, but I have taken out two questions because those were hard to explain and we do not have that much time. See, 5 minutes for reading and 10 minutes for the answering. So what is somebody saying? Yes. Okay. So now let's come to the part to the questions one. Okay. Answer these 7 questions. You have taken 5 minutes for this. Okay. There are what 18 questions, and I'll give you 3 minutes to answer questions 1 to 7. Okay. And I know not all the questions, not all the answers in text A or text B. So if you want, I will scroll it down as well meanwhile, but generally speaking, I'll only give you it's what I'll just generally give you 3 minutes to answer these 7 questions. So okay, hurry up. And do not write the answers in the chat, just attempt on your own. Okay, I have another file where the answers are given, then you can match your answer there. But your 3 minutes starts now. Okay, I'll scroll it down, but if somebody wants me to scroll down, type in the chat. Question 1 to 7. If you guys want me to stick the screen on specific part, please do let me know. I'm just scrolling it up and down so you guys have an ease and just read it. Just 1 more minute and then we will attempt the other questions. Question 1 to 7, please attempt in these. You have 1 minute left for attempting question 1 to 7. And yeah, this is one of the sample from the official OET website. Okay. What is somebody saying? Please do not scroll. Okay. Okay. I'll just keep it here on the text A to B where you can read here. Okay. One more. The time is up, but I'll give you 1 more minute. Hurry up. We'll just scroll a bit so you guys can see text C and D as well. Okay. Few seconds on the text C. See if there is any question related to text C in these. Okay. And a few seconds for the text D. You guys can match. Again, text C and text B. A few seconds here. Hurry up, and few seconds here, text A. Okay, I think it's enough for question 1 to 7. Have you attempted question 1 to 7, everybody? Tell me in the chat, otherwise I won't know if you guys have attempted or not. Yes, okay, perfect, perfect. Now from question 8 to 13, okay? Okay, perfect, perfect. From 8 to 13, you guys will have another, I would say, what, 4 minutes, okay? Come on. 8 to 13, another 4 minutes, and I will keep this file on the left one scrolling down and upwards. Okay. Okay. A few seconds on the text A, just match. If you have any answer here from the text A, then I'll pause on text B. Okay. Let's do that. I'll pause on every text and you match your questions. Okay. You guys have only 4 minutes. Match if there is any question in the text A. Is there any answer? Okay, I'll pause on text B for a few seconds. See if there is any question related to text B and you can answer it in the questions 8 to 13. I will just pause now on text C for a few seconds. See, what is this? Can we read the whole part at once, then answer the question? Yes, you can. You can read the whole part at once and then answer the question. But if you're good retaining that information in one read, okay, you can do that. But otherwise, most people, they have to match this. and that's the key. That's the key. That's what I'm saying. You go through the text 5 minutes for the first 5 minutes, and then take the other the last 10 minutes to answer the question. And to answer the question, you have to go through the text again. You cannot retain all that information. You cannot retain those figures in your mind by one read. But if you have a photographic memory, okay, please give me some of that. But otherwise, people have to go through the text. That is why I'm saying 10 minutes should be your aim. Okay, 1 minute remaining. I will pause on text D. Please match if there is any answer. Please go through the text D and see if there is any answer from question 8 to 13. Okay, what's the time? Okay, I'll again pause for a few seconds on text C. Have a quick look on it. See if you have missed anything in the questions 8 to 13. Okay. Go through text B quickly, see if you have missed anything, if you have to recheck. Okay, perfect. And now part A, you see match, reconfirm or whatever. Have you guys attempted everything? Everyone, can someone answer? Have you guys attempted or not? Should we go ahead? Okay, Asha, perfect. Okay, Casey, perfect. Okay, now coming the last 14 to 18. Okay, again, you guys have last 5 minutes. I'll give you 5 minutes. Again, I'll pause on text A for a while, then text B, text C, text D. Okay, see if there is any answer from text A, write it down now. Okay, you guys have 5 minutes to attempt these questions, and then it will be done. What if we read the question first and read the text so we can directly answer as we have short time to do so? Bibi Ghulam, you can do that. You can do that. You can, but you know what? Once you have gone through the text, you generally have an idea what are these four texts about. So once you read the question, you generally have an idea. You know, I have just read these four paragraphs. I know which paragraph is this asking about. So, but as I said, these questions are not in an organized manner. Any question can be from any text. So if you're reading the question first, and then you're looking for the answer, that is more time, that will consume more of your time. Okay, that's why I am saying the strategy should be first you read the text in the 5 minutes and then take the other 10 minutes and then look out for the answer. Then you will be know what you're looking out for. Otherwise, you will be just beating around the bush and you won't know what text has the specific answer. Okay, I'll pause on the text B now. See if you have any questions from text B and answer it accordingly. Okay, I will pause now on the text C for you guys. See if you have any question from text C, answer it. And now last pause on the text D. Okay, and you can match your answers. Okay, everybody has attempted or not? Or should you guys, or should you want me to go upward, scroll upward? You guys done? Yes, done. Okay, perfect. See, it doesn't even take 15 minutes. So we started the test at exactly, it's 5 p.m. where I am right now, and it's not even 15 minutes, it's 14 minutes, and you guys have attempted. Okay, now I will open wait a minute. Now I will open the file for the answers, and then you guys can match your answers. Okay. Okay, let me share my screen with you guys. Okay, this is the part of answering. Okay, everybody, you can match your answers. Scroll to part B. Part B. Okay. This is the part B. I haven't shared the answers right now. You guys done? Okay, so these are the answers. You can match your questions with it. So the first question is the various symptoms of patients who have taken too much paracetamol. Okay, What in which text you can find the information about? It's in the text D here. Wait, sorry. Will the computed test be printed on paper, or they'll provide us with the paper test be? No, the paper test will be printed on the paper. You will not be provided with the computers. You'll be having the papers. Okay. Okay, so in the various symptoms of patient who have taken too much paracetamol, see, these are the symptoms. These: hepatic necrosis, nausea, vomiting, begins to develop after 24 hours and can progress to, and these are also, patient also develop encephalopathy, oliguria, hypoglycemia, renal failure. These are the symptoms, and it is in the text D. Okay, the precise levels of paracetamol in the blood which required urgent intervention. Where is it? It's in the text C. Here. Are you guys matching your answers? Yes. Okay. Please do let me know how much of these have you got correctly and how many of you are not guessed it correctly. Okay, I'll not get in the details, but you guys generally now have an idea. I'll just show you the answers. Okay, these are the text. See, this is very simple. You have to read through the text and then you have to answer in which text you will find that information, A, B, C, or D. Okay, it will not take much of your time. You can do it in 5 to 6 minutes. Okay, after reading this, for I would say 3 minutes are enough for this one. Now, question 8 to 13. Okay, if paracetamol is used as a long-term painkiller, what symptom? Good, Asia, 7 out of 7. Let's say how many of you are getting 8 to 13. Paracetamol is used as a long-term pain. Almost none. It was my first. It was fast. No problem, Afifa. No problem. You will get through it. No problem. Just match these questions of your 8 to 13. Okay. The first one is, if the paracetamol is used as a long-term painkiller, what symptom may get worse? Headache. Okay. And then it may be dangerous to administer paracetamol to a patient with which viral condition? What condition may develop in an overdose patient who presents with jaundice? Okay, this I will emphasize on this one. Wait, let me. So this question, what condition may develop in an overdose patient who present with jaundice? This is the answer. Okay, some people may say hepatic necrosis, but see, that's what I said. You have to be very alert and attentive. It is written hepatic necrosis begins to develop after 24 hours and can progress to acute liver failure. Now, hepatic necrosis is elevated transaminases, right upper quadrant pain, and jaundice. These are all the symptoms of jaundice, and it can progress to acute liver failure. So if anybody has written hepatic necrosis, you guys have not read the text accordingly. No problem, Bibi Ghulam. You will get through it. I know it was fast. I was just giving you a taste of how the exam will happen. You guys won't have much time. 15 minutes are not very long. You guys will have very short time. Okay, match your other questions. What condition may develop on the third day after an overdose? Renal failure. What drug can be administered orally within 10 to 12 hours as an alternative to acetylcysteine? You write hepatic necrosis as, yeah, I know somebody would have done that. That's what I say. It's not hepatic necrosis. You have to be very attentive. Okay, methionine. What treatment can be used if a single overdose has occurred less than an hour ago? Activated charcoal. Coming to the last questions, if a patient has taken metoclopramide along paracetamol, this may affect the speed of absorption. Okay, after 24 hours, an overdose patient may present pain in the right upper quadrant, sorry. For the first 24 hours after overdosing, patient may have only such symptoms, which are nausea, vomiting. Acetylcysteine should be administered to the patient with the paracetamol level above the high risk line who are taking any type of enzyme-inducing medication. And the last one, if a patient does not require further acetylcysteine, they should be given treatment categorized as supportive. If you guys have written supportive treatment, it's fine as well, but it is supportive. Okay, I'm sure some people will be panicking, or some people may be worried that do not have got any question right, but that's totally fine. It was your first attempt. I was just giving you an insight and idea of what the reading is about and why so many people will fail, and why this exam is, you know, hard for some people. So that's one thing. We will do the part B. I want you guys to be with me. Do you have any question before I start the part B? Any question? 9 out of 11. But there are 18 questions, Asya. Why 11? Okay, now I will start the part B. Okay, so this is the part B. We will have 10 minutes for the part B, or generally saying this is the text. I'll give you few minutes, 16 out of it in perfect. Perfect. Okay, so this is, wait, let me zoom it out. Okay, yeah. So this is a text. What you have to do, you have to read this, and then you have to attempt you have to choose the right one from here. Okay. Okay, I'll give you 1 minute, or let's say 2 minutes. You have to read this and you have to answer this. Okay, do it now. Your time starts now. All of you guys, start it now. There was someone who was asking about the part B of the exam. I don't know who that person was. Let me go through the chat. Okay, Nihal. Are you there, Nihal? Are you attempting this one? Have you guys attempted this one? Okay. Okay, before I show you the answer, can you write in the chat what do you think is the right answer? Just type in the chat what is the right one. Okay, I can see a lot of people are saying C. Okay, so this is the answer, C. C is the right answer. Okay, why? As I said, you have to read in between the lines. So what this extracts tells you about, let me just, okay, C. Why is A not the right answer? Because C, A is the keys for the controlled drug cupboard are the responsibility of the nurse in charge. They may be passed to a registered nurse in order for them to carry out their duties and return to the nurse in charge. And it says must supervise opening of the controlled drug cupboard. No, it is not written here. Okay, it is not written here. And the B say should make sure that all ward cupboard keys are kept together. Here it is written the control drug cupboard keys should be kept separately from the main body of the keys. Okay. The C is can delegate the responsibility of for the cupboards to another ward. Yes, the nurse in charge should arrange for the keys to be held in a neighboring ward or department by the nurse in charge there. So it tells you that C is the most appropriate answer here. And this text is telling you that the nurse can delegate the responsibility for the cupboard keys to another ward. Otherwise, these two have, you do not have the relevant information in this one. Okay, I'm sure you guys can understand. Let's do another one. Let's do this one. A couple of minutes for you. Read the manual and choose the correct answer from the given choices. Have you attempted this one? Everybody, have you attempted? If you have attempted, please tell me what is the correct answer. What is the correct option here? Okay, a lot of people are saying B. Okay, let's see. Yes, you guys are right. The B part is the right answer. Why? See, again, you have to read in the text. Why is A not the correct answer? It says the patient should try a number of devices with their inhaler. It says spaces devices should not be regarded as interchangeable. Patient should not be advised to switch between spacer devices. Why is B the right one? It says the device allows more time for evaporation of the propellant so that a larger proportion of the particles can be inhaled and deposited in the lungs. And it says they enable a patient to receive more of the prescribed medicine. The C is children should be given spacers which are smaller than those of adults. Here it is written, it is important to prescribe a spacer device that is compatible with a meter dose inhaler. There's nothing written here that children should be given spacer which are smaller or adults. It's written compatible with the meter dose inhaler, which can be anything. Okay. Okay, guys, perfect. I think you guys are going very, very good. There is another one. I think this is the last one. Yeah. Okay, attempt this one, please. I've zoomed it out. Read this text. Another couple of minutes. Okay. Okay, let's see which one is the correct answer. Yes, A is the correct answer. Why? Again, as I said, you have to read between the lines. Why is B not the right one? Injection of these drugs will limit the need for physiotherapy. It says they should only be given under expert supervision and must be combined with active physiotherapy. It not says it will limit the need. Okay. Care should be taken if they're used over an extended period. Nothing in here gives any kind of information. Their use has been largely replaced by ventilated support, so nothing information relevant to that is given here. The patient, they may be useful for patients who are not fully responsive. Here it is written that patients with hypercapnic respiratory failure who are becoming drowsy or comatose, respiratory stimulants in the short term may arouse the patient sufficiently to cooperate and clear the secretions. Okay, this is, we are done. I have taken few examples of part B. A lot of people of you are not struggling with the part B. There was one candidate, I don't know if he or she is here, who was asking about the part B. Do you have any question or problem with part B? Tell me so we can start part C. We are running short of the time. So anybody has any question about part C, please ask now. No question regarding part C. No, thanks, Olga. Generally, the question can be repeated. Generally, the question can be repeated. What do you mean by that? I do not get your question. There, generally, the question can be repeated. Like in what sense? Okay, never mind. We'll start the part C now. Let me open the files for the part C, and then we are good to go for the part C one. If I read and practice, I can find the same question is wrong. If I read and practice, I can find the same question. Yeah, it's fine. It's fine. That's no problem. You can, as I said, this is the sample from the official OET website. So you may find the same question in the exam. It's no problem. Okay, I'll share my screen now. Okay, see. So this is the part B, but wait a second. Wait a second. Wait. So before sharing my screen, let me just tell you one thing. Okay, so I will just, let me just open it. Okay, sorry, was taking time opening the file. Okay, there you go. This is the part C. Okay, a lot of people now struggle with part C. So what is the key to attempt the part C? It has 7 to 14 questions, which say like it will generally have 8 questions. The key to attempt part C and manage your time and save your time is, the good thing about the part C is whatever the questions you will have here in this text, it is always in an organized manner. What do I mean by that? For example, you have multiple paragraphs here. Okay. The good thing about the part C is the question one will always be, this question one will always be from the first paragraph. Again, the question two will be from the second and third and so on. So it is always in this manner. Okay, in a chronological manner. So this saves your time. This tell you that you do not have to read all of this in one go and then attempt this question, because you have to attempt two of these in the real exam. So what is the key? The key is read the first question, go to the first paragraph, then you will know what you are searching about. Okay, so okay, I'll do it with you guys. So we will have 10 minutes for this one. Read the first question. What point is made about the death of female patient called Mary? It was entirely preventable. Nobody was willing to accept the blame. Surgeons should have tried hard to save her life. It is the type of incident which is becoming increasingly common. Now go to the first paragraph, this one. Read it and see what is the answer. I'll give you guys a couple of minutes and then I'll show you the answer. Have you guys done? You guys done with the question? We do not take too much time for this one. It's in the first paragraph. I told you it's in the first paragraph. Everybody, tell me what is the answer. Okay, there are four A, yes, D, A. So there is one person with A and a lot of other people with A. Yes, it was entirely preventable. Absolutely correct. Okay, how come you know that? It's in here. Because of confusion of three identical stainless steels. Okay, absolutely perfect. You guys are going good. Sorry, zoom with. Okay, now the second question. Okay, the second question is from the second paragraph. Okay, please, this is the second paragraph. Read this one and try to answer this question too. Hurry up. Okay, tell me what is the correct answer. Everybody, C. C, 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 C. Okay, there are four answers with C. One, two, three, no, three answers with the C. Someone is saying B. Okay, A. Okay, okay, interesting. So not many people have the same answer. Let's see what is the answer. The answer is C. Staff focus their attention on a limited number of issues. And why? Let me focus on this one. Why is this the correct answer? Because here it is written, in other words, people concentrate on the areas that are being incentivized but neglect other areas. Okay, so staff focus their attention on a limited number of issues. Okay, yes, these A can be your right answer, B can be your right answer, but the question is what is meant by the phrase effort substitution? Okay, effort substitution. So you should have a little bit idea what does substitution means. Substitutions mean to, change one thing or to have an alternate for another one. Okay, so in this context, the correct answer is staff focus their attention on a limited number of the issues. Okay, time and energy is wasted on irrelevant matter. It is not written here. This does not mean by effort substitution. Okay, let's do another one. Let's go on the third question by quoting Dixon words in the second paragraph. Again, it is from the second paragraph. Okay, you guys can see by Dixon. This is the beauty of the part C. As this is the third question, technically it should be from the third paragraph, but it is written in the second paragraph. Okay, so again, you have to focus on what? You have to focus on this one. Okay, quickly, guys, you have gone through the second paragraph. Quickly answer this question, that by quoting Dixon words in the second paragraph, the writer shows that the professor, what? Quickly, guys, come on. In the second paragraph, you should not take that much time. You have to attempt two of these in the real exam, so better be quick. What do you think is the correct answer? B. Okay, there is one person who said that answer is the B. What about other one? What about other people? No, nobody is interested in answering this one. C. Okay. A or B? B maybe. Okay, let's see what is the correct answer. The correct answer is A. In the see, it's written here. It's written in the second paragraph. The writer shows that the professor understands why it is she admits going to be a challenge. Many different policies and approaches have been tried. Okay, and often with unintended consequences. Financial incentives are widely used. Okay, and again, people concentrate on the areas that are being incentivized. So that is why she said she understands why healthcare have to make certain choices, because why? They are being incentivized, they are being financially incentivized. Okay, that is why she understands why healthcare employees have to make certain choices, because there is a motivation behind that. Again, as I said, you have to read very carefully. Okay, a last question. They have other questions, but you're running out of time. What point is made about the checklist in the third paragraph? Again, as I said, it is in the chronological order. It's written in the third paragraph. Okay, this is the third paragraph. Quickly go through it and tell me what is the correct answer. Okay, hurry up, guys. I will give you only 1 minute for this one. Okay, guys, tell me what is the correct answer of this one. I think it's really easy. D. Okay, two people are saying D. One person is saying B. Another one with the D. Okay, let's see what's the answer. Yes, it's the D. Absolutely correct. Why? Because here it is said they also reinforce that the hierarchy, sorry, they would tick the box to say that the patient had their antibiotics when there were no antibiotics in the hospital. So the information recorded on them does not always reflect reality. Absolutely correct. Okay, there are other questions as well, but again, as I said, we are running out of the time. Okay, so I will just end this practice session here. Okay, you guys have an idea of what this reading exam is about, how you should attempt, and how much time you should be given to each and every part. And you guys must have an idea which part should be hard for you. Some people would find the part A easy, people will find the part B, and some people will find the part C easy. So again, it was just an insight. It was just to give you an idea of what this exam is about. And I chose the reading part because a lot of people are complaining nowadays that reading is difficult, when in reality it is not that difficult. All you have to do is you have to be attentive, you have to be very smart in managing your time. So we have 10 minutes left, and I will take this time for your feedback and for your questions. Please do ask me if there are any questions. I can see many people have left. Again, yes, this can get very boring, this practice session, this practice exercise. If you guys have any question, please do ask, or if you guys want to give a feedback about this webinar, how you should want to learn, if you want certain things to be incorporated in next sessions, please do let me know. Okay, any question, any feedback, really appreciate that. Please do ask me or tell me. Thank you, Dr. Asma. I hope it's clear for you. And thank you, Dr. Asia, as well. I hope this session was helpful. Ali is saying, when preparing for OET, what should be our strategy? Should we do reading part first or any of them? Ali, I think you're confused. So when you're doing OET, it is in, you do not have the choice to attempt the reading part one or listening part one. Okay, the thing is, firstly, if you're taking the exam on paper, you will, or even on computer, you will firstly attempt the listening, then you will attempt the reading, then writing, and on the last, then you will attempt the speaking. So it goes that way. You do not have the choice to do any part first or any part later. Okay. Look, Tariq is saying, thank you for your time. Good information. How much time usually I need to prepare to take the exam? Again, I answered this question earlier. It depends. Okay. Some people may be doing jobs simultaneously. Some people have other responsibilities. Okay. So it depends. Again, how much time do you have left for the exam? When is your exam? It is a very subjective question, but generally saying, if you have a month before your exam, then you can start a month before, and 2 3 hours a day you can practice. Thank you. It was very helpful, Shannon. Thank you so much. Thank you for the one. Please do arrange more if you can, sir. I'm talking about the preparation, not the attempting test. Okay, okay. So you are asking about the preparation thing. Ali, it depends. If you think that you're good with the preparation, if you think you're good with the reading, then I would say do 6 to 7 practice tests. You're good to go. But if you think you struggle with the reading one, then I would say keep just a week for the reading one. Okay, you do not want to mess out. This exam is costly, and you do not have to make the choices. There are certain days, there are limitations for the dates. So please, I would say a week or something like that. Okay, it will be great if you arrange any webinar to elaborate different routes of UK other than PLA for medical practitioners. Well, Mariam, I think we cannot do that webinar, but generally speaking, there are 2 3 routes to UK other than PLAB. One is MRCP or equivalent MRCS, MRCAM. You have to be done with all of them to get the GMC registration. Okay, and the other route is if you are a trainee here, then there is in Pakistan. I'm saying about Pakistan. I do not know about other countries. You can go through exchange program, but then again, you have to come back to Pakistan. Okay, and Doctor, could you please explain remark of speaking and writing examination? Asya, like remark of what? Speaking and writing. I'm confused. What exactly are you asking? And please, people, do let me know if you want. I tried my best to give you an idea of reading. So, would you like these kinds of session more if we do listening, speaking, do you think this is enough, or do you want another, more effort so that can help you? Thank you, Ali. Actually, I'm waiting for you. Can you please let me know what do you mean by remark of speaking and writing? I mean, do you have another chance of taking exam separately if you, oh, okay. So you mean remarking. I am not sure if you, yes, you can ask for the remarking, you can, but no, you do not have this option of retaking the exam separately for only one subset. You have to take the exam as a whole. You do not take one subset. Okay, more practice sessions will be more helpful. Okay, we'll try to do that from where I can practice reading. Sarah, you can try practicing reading. There are lots of samples on the official OET website. There are lots of materials online. You can find that. And but if you do not want to scroll through the internet, just go through the official OET website. There are lots of samples uploaded there. More sessions and reading and writing, please. Okay, may we have a session on writing? Yes, of course. So we will see, we will planning to start our official OET this course, and in that course we will have 4 weeks. We will that will be for 4 weeks, and in each week we will have 4 classes. So 4 weeks for 4 subsets. Okay, or maybe we will do all of the subsets in 1 week. So saying we will have 4 sessions. Okay, so yes, we will have reading sessions, writing sessions, and we will, whatever we will have. I want to make sure that our session is interactive. A lot of people will leave in between, but that's not helpful for you, and that's not helpful for even me. Even if I'm not getting feedback from you guys, I don't know where you guys are struggling, I cannot help you. So I will try to make these sessions very interactive. I'm not here to judge you, I'm here to help you. So if you guys have any problem, if you're struggling with anything, please do let me know in the future sessions. We will try to start our session officially from the mid of March, but we'll see. We are under some planning, and we will let you know, guys, in the WhatsApp group when we are trying or when we are planning to start. So, any other question, please? Okay, I think not. There is no questions. Any feedback? Any question, guys? Before I leave, anything about reading, listening, speaking, whatever. Thank you, Joy, for sticking around. I hope this session was helpful for you guys. Okay, thank you everyone for your time. Thank you for your efforts. Thank you for sticking along. And I hope that you guys had a wonderful time and this session was helpful for you guys. So I'll see you guys in the future. And this is how our OET sessions will be going along. And FIFA is saying it was helpful. We'll be waiting for the session in Plab. Okay, FIFA, as I said, we're planning for the Plab session, but we have to go through a lot. We have to gather material, we have to gather time, and it takes time. But yes, inshallah, soon we are planning to have a session on Plab. And in that session, exactly, it will be like that. It will be like this session only. We will providing you with the information. We will providing you how to prepare for the Plab and then we will start with some sessions as well. Okay, guys, take care of yourself. Enjoy, start preparation. If you're in the middle of the preparation, practice. And I hope every one of you will ace the OET exam. Okay, take care of yourself.